We appreciate you guys taking the time. But we are going to organize the meeting like we would sort of any work session, learning session with that. So Jonathan, go ahead and take it away. And we are going to be recording it.
Okay. All right. Well, thank you. Thank you, Mr. Wilbur. I'd like to call this meeting of the Budget Advisory Commission to order. We are in a learning session today. So just so everybody knows, we won't be taking any actions. But this is an opportunity for us to listen and learn to one of our valuable resources here in town, Dr. Kevin Barry. And so we're gonna, it is being recorded. So just everybody remember that we're under public meeting rules. And so with that, I'll start with our land acknowledgement that we are meeting in the unceded lands of the Dena'ina people. And we thank them for their graciousness in hosting us. So let's do roll call. Chair Rodriguez, here. Anna, Ms. Brawley.
Here.
Okay. Ms. Hobson, not here, I believe. Ms. Hotch.
Here.
Mr. Clouda.
Here.
Ms. McConnell, we're expecting her to be absent. Mr. Minor. Not here, I believe. And Mr. Smallwood.
Here.
Awesome. Here is Alyssa, which means that I get to hand over the reins. So, hello, Alyssa. We are right at the point of approving the agenda. So if you would like to take charge, we've done the call to order, the land acknowledgement, and the roll call. So now we're on to the approval of the agenda. Madam Chair.
Yeah, thanks so much. I'm so sorry that I was running late off my last meeting. Okay, do we have a motion to approve the agenda?
So moved. This is Nolan.
Awesome. Do we have a second?
Second, this is Tasha.
Thanks, Tasha. All right, agenda is approved. So, all right, I think Dr. Barry, we're ready for you. Cool. Did you want to share your screen and do you have access?
I will share my screen right now. I'm not a normal Teams person, so
okay.
Take me just a second.
Yeah.
Okay. I think y'all can see what I'm trying to show you.
Yes, we can see your PowerPoint.
Okay, so I want to say thank you first for the invitation to come speak with you all today. It's going to be a little bit of a different talk because I'm kind of a weird economist, I've noticed over time. My background with this is basically I wrote my dissertation on preventing pandemics from occurring back, that work started in 2011. I researched the economics of social distancing before it was cool, back as a postdoc at the Yale School of Forestry, before it became the Yale School of the Environment. That started in 2015, 2016. Before I joined UAA at the Institute of Social and Economic Research, I left the Institute this fall just to join the Department of Economics in a fully funded academic position. And so I'm going to come at this maybe from a little bit of a different perspective than you're used to, more of an academic perspective focused on behavioral change and the role of sort of self-protective behavior in the COVID recession that we're seeing in Anchorage. So a little bit less of, I think, the normal talk that's very focused on or sort of measuring the impact and more the root causes behind what's happening. And so when I look at this kind of a problem, I like to sort of break out what's happening before I start the talk so that we're all kind of on the same page. There's really two major policy problems occurring right now. The first one is the obvious one that I think most people are maybe most concerned about directly, which is morbidity and mortality. People either directly or indirectly being negatively impacted by the health shock. People dying, people being infected, people facing long-run health consequences. And then additionally, people with other conditions who could potentially lose access to care or delay care as the hospital system is overwhelmed, or as they decide that they're unwilling to seek treatment because they're worried. The second major policy problem that is arguably just as large and just as serious and has many other long-term consequences as well, though, is the economic harm caused by the COVID-19 recession. And so part of what I'm going to talk about today is how these are two simultaneous shocks and that there's not a trade-off between fighting the two of them. As much as we may hope and wish that that's the way things were and that we could just ignore one and the other would go away. The empirical evidence suggests that's not true. And so economic harm, I'm going to include both, for instance, GDP, consumer spending, and income, but also the social ills that are associated with the current COVID-19 recession, which are things like mental health impacts, domestic violence, and substance abuse. And we'll talk a little bit about those, what they look like nationally, but also in Anchorage specifically. And basically, I'm going to use economics again, and I'm not saying this because you need to hear this, but because I need to say it for myself. I'm a little bit different as an economist, so I'm going to really be thinking about this as a framework to make decisions, not necessarily providing you guys with the data you need to actually make those, which I know everybody always loves me for that. But I won't give you the answers today. This is more just putting everything in an ordered way to think about into the future. And so my three key takeaways from what I'm going to discuss today are really that COVID-19 is an unprecedented shock to the economy, which I think everybody knows. It's a simultaneous health and economic shock. Cost-benefit analysis is complicated because of these two shocks. So the report that I wrote last summer that y'all referenced in your invitation that focused on the economic cost-benefit analysis of shelter-in-place orders in Anchorage is complicated by the fact that we can't attribute the full economic recession to those lockdown orders because COVID-19 was happening at the same time and people are responding to the risk of becoming infected. But if we do a basic cost-benefit analysis, the lockdowns likely pass the cost-benefit analysis test, with a big asterisk that they are still not the best policy if we have other options that we are able and willing to pursue. And I'll talk about what some of those are towards the end of this session. So the health mandates as a preview of what I'll talk about, health mandates that both reduce the risk of infection and allow safe economic activity are pro-business. So at the end of this, I'm basically going to cheerlead for masks and social distancing and anything that allows us to address the health shock while also simultaneously addressing the economic shock, getting us back to normal while still minimizing the impacts of COVID-19. So the first thing that I think is important to mention every time we talk about employment is that COVID-19 is an incredibly unequal economic shock. This is not impacting everybody the same, and frequently people who are higher income, work jobs that are easily done remotely, particularly office jobs, are feeling like the economy has largely recovered. But that is not true for everybody. So early on, there were much greater declines for Latino and Latina workers, younger workers, women, folks with larger families, and those who are less educated and worked more face-to-face jobs. And the recovery has been unequal as well. So I'm citing two papers, one from Montenevo and others, that's in the National Bureau of Economic Research, and one by an author named Couch and others, that's in the Journal of Public Economics. The unequal recovery is basically because there were disproportionate negative shocks to employment for Latin people and African American peoples. While they saw a smaller overall early shock during the pandemic, the jobs that they lost have not been recovered. So Latin people have not recovered faster, and so they're both lagging on average white people in this recession. And so this is just a quick summary graph that, again, we can see that these groups I've mentioned over to the left are disproportionately suffering in this recession, and this pattern is slightly different than historic recessions as well. So I've got some data that I'm going to show quickly that I think you guys are, if anything, given I'm speaking to several economists, are maybe more familiar with than I am. So I'm not going to say too much other than the negative employment shock, and this is in Anchorage, was large from COVID-19. It was big, and the gap has not been resolved yet. Particularly, if we look in sort of sectors related to like tourism and dining and bars and accommodation, right? So accommodation, leisure and hospitality, food services and drinking, retail and trade. All four of these figures are plotting employment numbers in Anchorage from January to December over 3 separate years. And you'll see that 2020, which is the green line, is significantly below 2018 and 2019, which are the red and blue lines in all four figures. So unsurprising, large negative employment shocks across sectors that predominantly have younger workers working face-to-face, lower income, and lower education jobs. So it's an unequal and historic recession. But we also have to keep in mind, too, that particularly for Alaska, other things were occurring. So we can look, for instance, at employment in oil and gas. Oil and gas did face an impact from COVID-19 and the reduced demand for oil globally, but also other sort of strange headwinds like the oil price war between Saudi Arabia and Russia, and changes in the presidential administration, expectations about regulation, and different things going on. There's a lot of stuff going on with oil. As not an oil economist, I don't want to get into it. Just to say that there was other things going on that impacted the Anchorage recession or the Anchorage economy at roughly the same time. Now, my contribution, and the first thing that I'll talk about, is the report that I wrote last summer and that I've updated since in the last couple of days. That was built on what's called an epidemiological SIR model, which is a susceptible, infected, and resistant model. So people basically fall into one of three buckets in the simplest version of this model. You are either susceptible in that you've never been exposed to the disease and have the possibility of becoming infected. You are infected in that you are infected with the disease and you are infectious so that you can infect others. Or you're what's called removed, in that you're either resistant or quarantined, or for whatever reason, you are no longer infectious to other people, but it is not possible for you to become reinfected. And so I used this model to basically explore, in very broad terms, what an uncontrolled outbreak with no behavioral response in Anchorage might look like. And that behavioral response could include either lockdowns and mandates, or sort of self-protective behavior. And there's a long literature that suggests that in other disease outbreaks and in COVID-19, people typically try to limit their exposure to getting sick, particularly when there are acute disease events, things like large influenza outbreaks or outbreaks of diseases like, for instance, Ebola, where people canceled trips, or Zika or other diseases where people try and protect themselves. I've got my own paper on this, looking at, for instance, even endemic Lyme disease in the Northeast, where people spend less time in areas where they are likely to get Lyme disease. So this model has a couple key parameters. The first one is sort of in the news all the time, so I think most people are familiar with it, but it's called R0, which is the number of new cases from an infected person when they are introduced into a population that has no prior history with the disease. So it's the number of new cases from the first infected person in a population that is otherwise all susceptible. So COVID-19 has an R0 that's estimated in a range between somewhere around 1.6 and like 3.5 to 4 in the literature. I fit a curve, an estimated R0 based on the first 2 weeks of cases in Anchorage, trying to think of a time period where people would have the smallest endogenous behavioral response, where we would avoid things like people trying to protect themselves from the disease by staying at home, and estimated an R0 of about 2.72, which is consistent with the literature. So I believe it, or at least I think it's about as good as any other estimate out there. And if I took one from the literature, the number would have been very similar. The average infectious period that I used was about 7 days. This is based on roughly when people are likely to get tested and start to self-quarantine if they are infected. I've ranged this as well between about 14 days or 2 weeks, assuming people don't ever quarantine and they just run the full course of the disease and it takes about 2 weeks to recover, and shorter periods too of 3 or 4 days, assuming people get tested as soon as they're symptomatic and immediately quarantine before they even know the results. I've used a population of 290,000 people just to have a neat round number, an infection fatality rate of 0.5%. So if somebody is reading my old work and then watching this presentation, you'll notice I'm now using a lower infection fatality rate. At the time, one of the best estimates was about 2% on the high side. Thankfully, we now know that's lower. It's still an order of magnitude higher than, for instance, influenza, particularly for older people. It is lower for younger people, though. And this infection fatality rate is constant in the model as well. These are the equations if anybody wants to get in the guts of the model, but the basic idea is just that people move from being susceptible to infected, and then they move from being infected to resistant, depending on how quickly they recover from the disease and how infectious the disease is. If I wanted to include phenomena like overwhelming hospital capacity, which has been a key problem, particularly early on in the pandemic in places like New York and Italy, this infection fatality rate should get higher when the infection rate crosses some threshold. But I didn't include that to sort of get a conservative estimate of what fatalities might look like in Anchorage based on an uncontrolled outbreak. And so the quick results are, had nobody changed their behavior, had nobody started to self-protect by wearing masks and staying home and socially distancing, had there been no shelter-in-place orders, the pandemic would have ended roughly in June. There would have been roughly 266,000 cumulative cases and a range between 186,000 to 280,000. Basically, everybody would have gotten it. And we would have seen fatalities of ranging between 930 to 1,400. And these are likely an underestimate again, because it ignores overwhelming of healthcare capacity and other excess deaths from losing access to hospitals. So this is a lot of people. And also this little figure down here on the right is just the fit over the first 2 weeks, plotting the red curve, which is my estimated pandemic for when it's uncontrolled, and the blue curve, which is the actual case count at Anchorage. So you can see here that Anchorage actually did significantly better than a completely uncontrolled pandemic. Some of the vertical lines in this plot here, this is the first shutdown order in April, and the lifting of the order is the second line. This solid black line here is going to be, which is the third line from the left, is the imposition of the Anchorage mask mandate. Then the, the fourth dashed line and the fifth dashed line are the August reset. And then the lockdown in December is the last pair. And so you'll see also that Anchorage regularly returns to shelter-in-place orders throughout this data set too. As sort of a thought experiment, I asked what would happen if we had held R naught to just barely above 1. And basically, we would have seen almost no cases in Anchorage without reintroduction from other people arriving via the airport or other ways into Alaska. And nobody arguably would have died had we done it if we had basically squashed the outbreak early on. This is not a realistic scenario, but sort of as a baseline, we can say, well, we can either compare reality against the worst case scenario or reality against the best case scenario. But now it puts us in a place with this kind of an analysis to do sort of a back of the envelope, what did behavioral change save Anchorage calculation? So Anchorage's reality is that we had about 26,000 cumulative cases as of yesterday. About 9% of Anchorage has been infected. Most of us are still susceptible. Most of us can still get COVID. We've had about 150 deaths. The best estimate, again, my median estimate of a COVID outbreak with an R naught of 2.72 is that we would have had 266,000 cases with 1,300 fatalities. So we've avoided, compared to the worst case scenario, about 240,000 cumulative cases. We protected most of our people through behavioral change. And I'll again say that this is both a combination of, for instance, the shelter-in-place mandates and just Alaskans doing the right thing, right? Reflecting that they can protect themselves, their family members, and others by reducing their time in public, wearing a mask, socially distancing, and doing all the stuff that's really been drilled into our heads at this point. Now, a simple back of the envelope calculation again is that we've probably avoided about 1,100 avoided fatalities. Again, this is potentially a low number because if we overwhelmed our hospital capacity, we'd have excess deaths from other conditions as well that would have to go untreated, and COVID patients that would have otherwise survived, but would not because we overwhelm our hospital capacity. If we use a VSL of about $7.4 million from the EPA, which is a pretty standard cost-benefit number, we've avoided about $8.7 billion in mortality, with a range between $5.8 to $9.3 billion. For context, I don't mean to compare GDP to the value of a statistical life calculation, but the Anchorage GDP in 2019 was about $26.4 billion. So even if we blame the entire recession in Anchorage on the efforts to fight COVID-19 and say that there is a one-for-one trade-off between health and the economy, likely this passes a cost-benefit analysis. The behavioral change in Anchorage has likely saved enough lives that it was worthwhile, even if we assume it was all due to the recession. And one of the other neat things from SIR modeling.
Dr. Barry?
Oh, sure.
We have a quick question. Are you okay with taking some questions as we go?
Oh, yeah, no, just wait. And even wave me down whenever. I don't know if I can see a chat bar.
Okay.
Jonathan has a question. Thanks.
Hey, Dr. Barry, thanks for taking the question. It's actually a bit of a clarification in that it's the first sub-bullet under Anchorage reality where it says 26,000 cumulative cases. I think we have to be careful here because there's a difference between confirmed cases and infections. And we know that there are probably 2 to 3 unconfirmed cases, so 2 to 3 infections for every confirmed case, right? And so in reality, based on that knowledge, in reality, we're probably closer to 25 to 30% of Anchorage having been infected, and 9% of Anchorage has been a confirmed case, right?
So this is a good point, and I appreciate you bringing it up. So
Yeah.
I've seen, so the amount of asymptomatic transmission is still sort of an active football. Like
Right.
people are not sure yet what it is. So there are the high ranges, right? That it's 2 to 3 cases for each one that we see. The
Sure.
low range is something like 1 out of 5 cases might be asymptomatic, in which case it's something like for each one we see, it's 25. There's for each 4 that we see, there's 1 asymptomatic case. I do think that's definitely worth bringing in, that this number also has a range around it, right? So it could be that we are at 12% to a quarter.
And then we throw in the people who are not asymptomatic, but they're just simply go undiagnosed because they never go and get tested, right? And so that adds that number. So I guess my thing here is, because we don't know what that upper bound is, and it's not really applicable to the analysis, is to say that 9% of Anchorage has been confirmed as a case, not 9% of Anchorage has been infected. And just because I think it's important to just get that on the record, because this is being recorded and it may be viewed, that 9% of Anchorage has been confirmed as a case, not 9% of Anchorage has been infected.
No, I appreciate that point. And actually, it reminds me, one other point that I should make here as well is that this is not including vaccinations, which have recently started and kicked up, right? So we've now seen roughly twice as many people have been vaccinated as have been confirmed in the past as being sick. So we're hopefully have many more people who are resistant than this 9% number. So we're potentially closer than what we think, which I think when I get to the part about masks is doubly encouraging too, because it potentially means that we can get more people to feel safe enough to return to more normal economic activity. So thank you for the comment.
Yeah, and thank you for taking it.
Oh no, yeah, for sure. I'm an academic, so like you guys are super nice. Just jump in and like whatever, wave me down, say whatever you feel like. Nobody's insulted me yet, which is weird. But so we can also do simple experiments with the SIR model as well. So this is sort of fitting a curve to have the predicted data and the observed data be roughly the same at the start of the December reset or December lockdown, where we potentially watched 67,000 fewer confirmed cases and maybe several hundred avoided fatalities from that lockdown. So the point of this is not necessarily the direct numbers, but that these meaningful behavior changes that bend the curve have large economic benefits from the reductions in mortality on their own, and even conservative estimates in the reductions in mortality, because of course we're ignoring here the additional deaths that would have been caused by overwhelming our hospitals. And anybody who is watching hospital capacity in December, in particular late November, knows, right? We got down at several days to like 5 open ICU beds, which is not good. So what I want to talk about now is the effectiveness of those orders and what the literature says about them. So there's a paper that was in the National Bureau of Economic Research working paper series. It's now published in Economic Inquiry on shelter-in-place orders and whether or not they work. Basically, there is strong empirical evidence that they do increase the percentage of people staying at home full-time. They increase it by about 10%. 3 weeks after a shelter-in-place order, cumulative cases fall significantly, and they lead to significant declines in both cases and deaths. So the published empirical evidence seems to be that shelter-in-place orders do reduce the amount of cases and the amount of fatalities from COVID. Now, if we think that this behavioral change is purely because of the shelter-in-place orders, we might also expect if we lift these restrictions, we would immediately see an economic recovery, right? People would return to what they were doing before and things would go back to normal. But there's work by Raj Chetty and others at the Opportunity Insights Tracker. They've got an entire neat paper where this figure is pulled from that shows that there's really insignificant evidence to show that reopening does lead to a rapid recovery. Some portion of the economic damage is simply due to people trying to avoid getting sick. And so I pulled a figure here from a case study that they run between Colorado and New Mexico. Apologies, I'm not sure how to, I know how to zoom in Zoom, but I don't know how to zoom in Teams. But this top left is an event study that compares Colorado to New Mexico. They close roughly at this point together. I think you guys, can you all see my cursor? If not, let me see if this, well, I think y'all can see my cursor. So the first line in the top left, yeah, this is when both states close. Colorado opens first, and you can see that the trend between these two states is roughly the same. This is a measure of economic activity. Same thing happens looking at, consumer spending between a bunch of reopened states and a bunch of controlled states. Alaska in this study is included as an opened state where they compare each state to a counterfactual of several other states that stayed closed at the same time and then stack them all based on the same date. So that's why not all these states opened at the same time. But again, there's no difference in trend between control states and reopened states in consumer spending, employment. There's a small difference in the number of merchants opened. But this would suggest that they're opening, but they're not seeing an increase in people actually spending money or hiring very many people back. They're basically opening and then seeing no business, which would suggest that reopening overall has very limited effects, that most of the economic damage is again driven by voluntary behavior. So I've got a couple other studies I like to cite, again, looking at the literature here that I'll bring up. It's been a little bit since your econometrics class. These focus on different, or if you're watching this recording, they focus on a methodology called difference in difference, which if you've never heard this term before, it's basically a way of setting up a natural experiment. So this is a plot from one of the NBER papers I'll cite in a moment that basically says you find two localities that are otherwise the same. So for instance, Iowa and Illinois, and two communities that are on different sides of the border. For instance, Davenport and Rock Island. These towns, I don't know if you've ever been to Iowa, but this entire part of the country is roughly all the same. It's flat, there's corn, and there's some people, and it all is roughly the same. But Illinois had a shutdown policy, and Iowa did not. And so we would expect changes in traffic to businesses to be slightly different between these two states if the shutdown orders make a big difference. If they make a big difference, there should be a huge difference in consumer activity. What we see is that the difference is actually really small, right? So a 76% reduction in beauty salon visits in Illinois versus a 69% reduction in beauty salon visits in Iowa. Electronic store visits, 70% in Illinois reduction, 61% reduction in Iowa. There is a small difference, but it's not big relative to the entire economic shock. And what you can do is repeat this study across the entire country, finding these border effects where one municipality or one location faces a policy that the other doesn't, but they're otherwise the same population, right? Most people in Rock Island, or not most people, many people in Rock Island might work and spend time in Davenport and vice versa. So the only difference they're facing is this policy telling them to stay at home. So this would suggest that most of this difference in activity is voluntary. And that's basically the summary of the next couple of papers I'll talk about. There's one by Cronin and Evans in the National Bureau of Economic Research that they used nationwide cell phone records and traffic to essential and non-essential retail, entertainment, hotels, restaurants, and business services. And they found basically that stay-at-home restrictions only explain a modest fraction of behavior change. Most of it is private self-regulating behavior. Smaller declines in essential retail. So people who are choosing when to spend their time outside, are choosing to only go out to places they need to go, like grocery stores, and that public school closures have one of the most substantial effects too, if we are talking about policy changes, which as a parent, I can tell you, when the kids stay home, I stay home, and I think that's true for most people. Lynn and Messner have another great paper on the National Bureau of Economic Research, working paper, it's 27099, this link works as well, where they use nationwide cell phone records, initial unemployment claims, and stay-at-home orders, and basically find that policy changes have spillover effects across states. So one thing we wouldn't expect if it was simply the shelter-in-place orders is that a shelter-in-place order in Illinois should not impact Iowa, right? Because Iowans are not subject to it. But what seems to happen is that people respond to the news that things are bad enough that other states are locking down. And so they respond themselves and stay at home. There's little evidence that local stay-at-home orders are associated with the decline in economic activity because there is a common shock that is hitting everywhere, leading to the same consequences everywhere. I guess my take home from here is that the economic response to COVID-19 is not as simple as open things up and things will get better. They won't. There's no evidence consistent with a health and economy trade-off in their paper. And the virus shock and economic shock are common to the world as well. So individually, for instance, one small municipality in Alaska likely does not have the ability to turn off the COVID response globally, or for instance, in Canada, leading to, of course, the loss of our tourism season. And the next paper I'd point out is by Goolsby and Syverson. They have a study of 2.25 million businesses in 110 different industries. They find a 60 percentage point decline in consumer traffic during COVID, but only 12%, roughly 7 percentage points of the decline was due to legal restrictions. So most of this is voluntary, people staying at home because they don't want to get sick. Traffic starts to drop before the orders are in place and is more closely tied to COVID deaths. And there's several other papers I can cite that have similar takeaways. So the drop in economic activity, the drop in traffic is largely tied to the news on the number of COVID deaths and the number of COVID cases as people are trying to protect themselves, protect their loved ones, or do the right thing for their community and others by sort of participating in this effort to fight COVID. So there's also a clear shift in their paper towards smaller and less busy locations too, which is again evidence of self-protective behavior. For instance, people are, if they're choosing between two grocery stores, they're trying to go to the less busy, smaller location that fewer people go to versus the larger location that's busier. So all this suggests that we can't just return to normal. These papers are largely focused on lockdowns, which are extreme, and they work on reducing, and these lockdowns do work at reducing cases and reducing fatalities. And they do come with serious economic costs. It's just not the ones that many are pointing to. They're not driving unemployment and other things because that unemployment would occur anyway, right? If we didn't have the lockdowns, most people would stay at home. The bang from these lockdown orders is slightly better, basically, cooperation with shelter-in-place orders and efforts to fight COVID. That can meaningfully reduce cases, but it's not the sole driver of this behavior change. So if we can't just turn these things off because they replace voluntary avoidance behavior and add on to it a little bit, what can we do, right? If people are just choosing to avoid going out, and I think the biggest question, the one that I think, and I hope that y'all are focused on the most, is how can we get the most reduction in the spread of COVID-19 with the least economic damage to allow and encourage people to get closer to normal life, to make, for instance, Anchoragites feel safe going out to pick up food and shop at local businesses, to make tourists feel safer coming up here this summer, to get us back to normal and encourage some economic stability and a faster recovery. Well, if we take one more second to think about the costs of shelter in place specific to Anchorage, checking, I think it's the Department of Health and Social Services, their EPI group had a report that suicide in Anchorage has been relatively flat. It has not increased in 2020 relative to 2019. It had increased in 2019 relative to 2018, but it's been relatively constant. There's lack of evidence of an increase in crime using APD crime statistics that are publicly available on their website. There has been actually a reduction in violent crime and property crime. There's been evidence of a fall in academic achievement, though, in schools in the form of increased incomplete grades in Anchorage School District, and evidence at school. And this is at the same time, while there's evidence that schools are not a driver of disease transmission. So Emily Oster has a bunch of work that I would point to and suggest people look into because she's doing a great job of documenting COVID in schools, but I'm getting close to where I need to be, and I don't have time to cover it in this particular talk. But basically, her evidence is that a lot of this impact from having schools closed on achievement is coming at maybe uncertain benefit and reduced transmission. The takeaway from her work is largely that the prevalence of COVID-19 in schools seems to mirror the prevalence in the surrounding community, which is suggestive that that people who are becoming infected and being detected in schools are actually being infected at home or elsewhere in the community. And last, there is large evidence or reasonable and big evidence of an increase. There is significant evidence of an increase in calls to domestic violence and sexual assault organizations, both in Anchorage and nationally. So there's a paper by two authors named Leslie and Wilson, the Journal of Public Economics, that shows that there was a 10% increase in calls during the first 5 weeks of shelter-in-place orders to domestic violence sort of groups, helplines, and stuff like that. And the interesting thing, one of the interesting things with this work, it's a fascinating paper, is that closures and stay-at-home orders came after the start of increase in domestic violence. So this is in response, again, to the voluntary stay-at-home behavior. As businesses slowed down, as people were sort of furloughed, laid off, or scheduled for 0 hours, as people started to spend more time sort of during weekdays and work hours and abnormal hours together with their families, the amount of calls increased. So this is suggestive that it's not a response to mandates and quarantines and won't be easy to reverse unless, again, we deal with COVID-19. And so the lockdowns led to an increase in calls, particularly from areas without a history of calls. These are new calls in new places, not particularly driven by demographics, income, or industry. So there's no good way to put it. It's just that these are arguably new cases that are happening, not where people would have previously expected. So at this point, I think I've told you guys that we face it. I've told y'all that we face a trade-off. Lockdowns seem to work and likely pass a cost-benefit ratio, but they are not the only possible response. And actually, lockdowns and voluntary behavior seem to largely overlap. We get a little bit more bang for our buck during a lockdown if case counts get particularly bad, but most of the time they seem to not be as necessary. So the trade-off also, though, isn't lockdowns versus a return to normal. It's not that we turn the lockdowns off, end the mandates, and everybody goes back to normal and COVID ends, right? They're not the only policy option. The other ones that we have are the stuff we all know to do: masks, social distancing, limiting group sizes, and lower cost restrictions that reduce the spread, right? So mask mandates and things like that. They reduce the spread of the virus, which reduces the harm to human health. So they counter that shock, and they reduce voluntary avoidance behavior, which is the only way to really reduce economic harm. Now, if we want to do these two things simultaneously, we need to focus on the policies that make it safer to go out, that don't just encourage people to go out when it's still risky, because people are smart and they'll figure out the case numbers are climbing and they'll return to this self-protective behavior. But the goal of all this is really to avoid the risk of lockdowns in the future through targeted interventions so that we can avoid the need for blanketed, untargeted policy. And the way that we can do that, the clearest one that I know of is mask mandates. But anything that works like this, if you're looking for ideas, you want things that work like masks. So masks are the most commonly referenced non-pharmaceutical intervention, which is just an intervention that doesn't include a medication or a shot, a thing that you can just do. They work through two mechanisms: source control, where the empirical evidence suggests that they reduce particulates by 50 to 70% and slow the remaining particulates, and inhalation protection. So I'm not an epidemiologist. I'll focus on the economics of this. We call these community protection, or protecting others, and self-protection, protecting yourself. So the self-protection side is fairly straightforward, right? If masks protected people and that's all they did, we could trust people to voluntarily wear masks, and everybody could make their own private risk calculation and decide whether or not to wear these things. And that would be fine. The problem is the community protection seems to be the more meaningful of these two effects, which is that my mask protects you. And community protection only truly kicks in if mask wearing is universal. So there is a famous study that became famous for all the wrong reasons, focused in Denmark, where the authors mailed people masks early on in the pandemic in a community where community masking was not common, with a note suggesting they should wear it. People put the masks on and then promptly went to restaurants to eat face-to-face, where they took them off and ate in a restaurant. And they didn't see a significant effect from masks. I've seen this study cited a lot by people who clearly did not read it, because of course, that misses the key part, which is that the source control is a huge part of the benefit of masking. Universal masking is where it works. One person wearing a mask may imperfectly protect themselves because they may wear it wrong, they may remove it, things like that. But a community wearing masks simultaneously does see meaningful reductions in transmission. And we know that because there is now a growing and big literature that they work. So there's lab studies that show how they work through filtration, but there's a couple more classic ones, like the hairstylist study, where 2 hairstylists in Arizona were sick with COVID-19. They saw roughly 140 clients. About half of them were interviewed. None of the clients got COVID-19 because the hairstylists were wearing masks, and so were the clients. There was a Beijing study of 124 households with at least one member sick with COVID-19. Masks reduced secondary cases within the household by almost 80%. There's a Thailand study where those who report always wearing masks had 70% less transmission. There was a study on the USS Theodore Roosevelt where mask wearing reduced transmission by 70% once the limit is imposed. And then I say et al. Because the CDC has a list of like 70 plus studies. There are studies that look across all of Canada, that look across the United States, looking at mask mandates, that compare countries globally. At this point, it's about as settled science as you can really get before people just stop writing these papers. They're getting annoying. But the key thing that I want to point out, because I think everybody knows masks good at this point, is work done by a colleague of mine, Eli Fenichel, and his former postdoc, Yupe Yan, and Jude Baham and another co-author who I haven't met, so I don't know his name specifically, but they looked at face masks as an effective and common response. I helped early on with some of the data in this paper, but wasn't involved later on as a disclosure. But basically, face masks are a common and effective response. And if we think people are making trade-offs in response to the risk of COVID-19, if they are making calculations in their head about, if I go out, there's a possibility I'll get sick, and deciding not to go out, if we can make them feel slightly safer, they are likely to spend slightly more time in public. And so Americans subject to mask mandates tend to spend 11 to 24 fewer minutes at home on average, which means they're spending 11 to 24 minutes more in public on average. So this is an event study plot on the right for both mask mandates that are for the public in general, and the bottom panel is mask mandates that are only for businesses. On the vertical axis is there deviation from the average amount of time spent at home across all people. So you can see that in groups that before a mask mandate is imposed, where the observations are blue, in these counties where people increase their amount of time outside after in these counties that eventually get mandates, people were roughly the same as in counties that did not get mask mandates. Once they get mask mandates, their time inside, or their time spent at home, been teaching since 9 a.m., so I'm getting a little jumbled. People basically reduce their time spent at home. And so I think the key question then is, where do these people go? So they put a mask on. What do they do when they go outside? Do they go on a walk around the block? That doesn't necessarily help the economy. Well, they seem to increase their time spent at restaurants and eating places the most. From talking to the authors, they seem to take trips that are roughly long enough to correspond with picking up takeout or delivery food. So people in places that have mask mandates seem to spend more time consuming food from restaurants and other eating places. The second most common place they go is other amusement and recreation locations. And then gasoline stations and department stores are a little bit less significant, but they seem to spend the most extra time at restaurants and eating places, which suggests if we have a disproportionate impact on the economy focused on people in these sort of food and hospitality industries, mask mandates encourage people to go to these places, even if they're not eating dine-in. If they're just picking up takeout, it makes them more likely to actually go there and spend money. So mask mandates are particularly one form of policy that seem to be the most supportive of economic recovery. Although it's unclear what the impact is on overall risk, because if people are wearing the masks wrong, or if they're intentionally wearing low-quality masks, or if they're unintentionally wearing low-quality masks, or if they're wearing it around their chin, of course, it doesn't have the same risk reduction properties as double masking over your nose and mouth with a seal where you're breathing through the mask and not around the sides. So I think this paper is a key insight. It was published in Nature Scientific Reports for how we can possibly help the economy recover. And it's stuff like mask mandates that change people's individual risk calculations to encourage them to participate in the economy, but to do so in a way where they don't increase the overall transmission of the disease. And so I'll end with a thought experiment. And this is particularly, not necessarily just for the group, but for anybody who might be watching this in the future. Assume everybody in the world is not the same, but assume that they fall into three broad buckets. They're the never compliers, right? The folks who are living life as normal, who believe COVID is fake, or who believe that COVID is such a low risk to them that they don't need to respond to it. They're the people who are reducing their time away from home. They're making this risk calculation that I'm talking about, where they're deciding to spend less time in public and more time in their house away from people because they're concerned about getting sick, or they want to do the right thing for their community, or they want to protect their family members, right? They want to be able to see grandma. And the last one is people that are 100% hunkered down. They're maybe high risk and not yet vaccinated, and there is nothing that will convince them to go out in public at all. They're a year in and they are not now going to give up. What policies can we institute? And how many people in group 2 do there need to be? Or even group 3 that can potentially be made to feel safe, that they increase their economic activity, their spending and their time outside to justify a mask mandate? How many? Well, I think if we again do a cost benefit analysis, we can ask, what's the cost of a mask mandate? The cost of a mask to an individual, if it's free, is 0. If they have to buy one, it's like $5. If they already own one, it's zero. And most Alaskans, I think, own some sort of a face covering because winter. So we wind up in this world where every policy that basically can nudge people in group 2 and maybe a couple people in group 3 to spend a little bit more time in public in the economy in a safe way is pro-economic recovery and is pro-Anchorage. And so that's the experiment I think needs to be taken with most future policy measures is, are we going to get people in group 2 to go to Glacier Brewhouse and pick up a hamburger? That's where the recovery will come from. And of course, I guess the last thing I'll note before I finish, and thank you again for your time, is things like vaccinations do this. The faster we vaccinate people, regardless of who it is, right? It's good to prioritize vaccination, but in the end, any vaccine to anybody is better than a vaccine being wasted or sitting on a shelf. It will make people in group 2 feel safer and speed the economic recovery. So thank you all for your time. This is my contact information if anybody would like to reach out and discuss any of this stuff in more detail. Like I mentioned, there's some things that I've seen that are under embargo that I can't quite share, but I'd be happy to discuss with the group or with anybody, maybe, I don't know exactly the public meeting rules if we're allowed to do that. So maybe I'll just tell you in a month when it's out of embargo. I don't do these things frequently, but thank you for your time and your attention.
Probably the safest choice, Dr. Berry. You'll likely get a number of emails. So we've got about 10 minutes left. It's so distracting to hear myself echoing back. Any questions for Dr. Berry? Anyone? I have a question if no one is popping on. Oh, Nolan, go ahead, Nolan.
Yeah, through the chair. That's an excellent presentation, Kevin. I think there's a fantastic amount of information there that really speaks to a lot of the problems that we see. Do you have any comment? I know that one of the most maddening things about COVID is the misinformation that spreads, right? And what have you found? I mean, and so is there anything you can say about what resonates when you give these kinds of talks? Like, what data do you think persuades people that might be resistant to hearing the truth about COVID for I don't know, political reasons or whatever?
I'll be careful about how I phrase this. I think there is a meaningful group out there, right, they're building careers, whether it's in politics or elsewhere, on denial, on trying to argue that fake trade-off, that sort of fake counterfactual that I talked about earlier, where we can just turn everything off and go back to normal, is true. And it's not. Right, we can't just turn everything off. And so the thing that I think has become most convincing that sticks with me is that thought experiment example, which is you tell those folks, or the people, you don't tell those folks, because a lot of those folks are unreachable intentionally, right? You can't pay somebody to understand something they're paid to not understand, or you can't get somebody to understand something they're paid to not understand, is to talk to their audience and say, look, assume you're right and everybody else is wrong. All the scientists are wrong. All the economists are wrong. Every doctor is wrong. Most of the former COVID patients who are relating their experiences are wrong. And most people are in group 1. Okay, so most people would go back to living life as normal given the option. Again, how many people need to be in group 2 and group 3? How many people need to be suckers, right? Need to have been fooled by this conspiracy for us to be willing to make them feel a little bit more comfortable so they return to normal. Right? Because a 10% drop in economic activity, if it's 10% of people, is big, right? That's 1 out of 10 customers for the average business, right? So I've found it interesting, or maybe more successful, to point out to people that, look, maybe you're right and everybody else is just a wuss. But if you can make the wusses feel a little bit better, they'll go back to normal more, and the economy will get stronger and it will get a little bit closer to normal. If you keep yelling at them that they're wrong, they're not going to listen to you, for whatever reason. We're all brainwashed by this conspiracy. And so just yelling at people doesn't convince them. But if wearing a piece of cloth convinces people to return to their dining habits, and that helps the economy for 6 more months, fine. So I think that's the best argument, because like I mentioned with the study on Denmark, right, there's an incredible amount of misinformation and intentional misreadings of studies that is just, there is an entire cottage industry built around it at this point. And I don't know that any of the people who have bought into that are going to understand that they are wrong or admit that they are wrong, right? One of the most difficult things anybody ever has to do is admit that they're wrong about something. People hate it. And now people have built their identities around this. And so.
Yeah. All right. Lance has his hand up. Go ahead, Lance.
I think you may be muted, Lance.
No, thank you. Thank you for the presentation and the time. Excellent information. We were able to not only have the staff here at OMB join you, but we also have some folks from Treasury who are also very interested in, I think, in some of the work that you do. But my question to you is, we have a Budget Advisory Commission, and their job is to advise the Assembly and the administration on budget policies. And it's not so much what we're spending our money on and what we should or shouldn't be, but they advise at a high level. And if you had some advice for a commission that reviews the operating budget, they do make some decisions on special taxes or levies or programs or allocation of particular dollars that may come to Anchorage to address in this case, a pandemic. What advice would you suggest to this group, things that they ought to be looking at, and what should they be looking at in the next probably 10 months?
So I'd tell you right now that I broadly think the Assembly and the Muni in particular, I mean, I don't follow Assembly meetings enough to know which members are supporting which thing, but broadly the Muni has done a fairly good job of getting aid to people. But one of the things that's very different in this recession is that it's incredibly unequal, right? So like we mentioned, regular stimulus projects like construction and stuff, unless they're pulling in people who have lost jobs in impacted industries, are going to be less effective. I think one of the best bang for our bucks that we can really get is focusing on industries, particularly hospitality and restaurants and stuff, and getting aid directly to them. And this is all in the context of local policies, in the context of federal and state policy. The state, for reasons, has ended the emergency declaration and is maybe losing its power to do some things. But hopefully the feds are going to bring more indirect stimulus, the $1,400 checks and additional unemployment. The best thing that I think, in a broad sense, the Muni can do is target what aid dollars it receives and what it gets to the most impacted industries and most impacted households, which is trying to counter domestic violence, trying to impact low-income people who have lost jobs and having a hard time finding new jobs. That's our homeless brothers and sisters, and particularly helping businesses that are impacted, restaurants and bars. I think one of the things I didn't touch on, but that frustrates the hell out of me as an economist, is that prices send signals, right? I mean, they do. They tell us who should make what and how much of it. And pre-pandemic, a lot of businesses in Anchorage were perfectly profitable and healthy, right? Our restaurant industry was doing fine. And COVID has completely screwed that up. And we can expect that a lot of those restaurants that were popular in 2019 will be popular when COVID is over in late 2021, 2022. And so supporting them and keeping them open as well reduces some of the volatility and some of the sort of mess, because we can also assume that, for instance, if popular tourism-focused restaurants downtown closed, somebody's going to open, a very similar restaurant in the same spot. And all that's going to happen is that there's going to be a huge turnover and a lot of, uncertainty and unpleasantness. And so it'd be good to avoid those kind of things.
Okay.
So that's my high-level advice would be focus on aid to impacted industries, and focus on mitigating the negative costs of self-protective behavior, particularly funding things like domestic violence initiatives, and education as much as we can. And yeah, and then if anybody comes up with a better mask or something like that, if it comes down to a matter of money, spend it.
Yeah. So there's a number of us, myself included, that have to pop over to the assembly works session that starts at 1. But Anna, quick question for Dr. Berry before we officially end the meeting.
Sure. Thanks, and I'll be brief. First, the comment or the thought experiment you had really made me think of how we think about getting more people comfortable on bikes, especially on the roads. You know, there's a population who's always going to bike and, you know, throw themselves in traffic, and so you really focus on
Okay.
policies to help the those who are less comfortable or maybe need a little bit of extra support. So I like that thought. And I guess to your second point, I wonder, is there a fourth category where because your assumption with the 3 populations is they're making a choice and they have disposable income, but there's also, like you said, there's the folks who, you know, regardless of their desire, don't have money right now or don't have that, and probably are in that same category, like you said, of workers who have been laid off or worried about being evicted. So I just wanted to throw that out there.
I think that's actually a great comment. I should add that fourth category, right? Because those folks potentially need 2 types of help at the same time, or maybe there's actually 6 categories. There are those with disposable income and those that don't in each of the other 3. And another great place again for spending. Hopefully, more of this comes from the federal aid package through extended and expanded unemployment insurance and other, you know, like food stamps programs. But you know, folks are suffering, and the more we can mitigate harm to individuals and businesses, the faster the recovery after this will be. Because right, the price signals were there beforehand. A lot of these folks were gainfully employed in businesses that were profitable, that will hopefully come back if they can just weather this disaster.
All right. Well, with that, thank you to Dr. Berry for coming. This has been a great opportunity for us to kind of deep dive into a topic that, you know, normally we're bouncing around a lot, and so we really appreciate the wisdom. You know, virtual clapping for Dr. Berry, and thank you. Can I have is there a motion to close the meeting?
This is Anna. Also move.
Okay, and I need a second if there's one out there.
Tasha, second.
Thank you, Tasha. So thank you again to Dr. Berry, and thank you to everyone. Is there any opposition to closing the meeting? And with that, we are officially done. I want to thank everybody for their time, and again, thank you to Dr. Berry. That was awesome.
Thank you all for your time and for the invitation. Best of luck.
Thank you.
Thank you.